Patients that aren't getting better, they're amazingly confronting, and I'm sure we've all had these, but it's how we deal with these patients that really is a key ingredient of how successful we've become as a practitioner. Now, I remember I'd only graduated maybe a couple of months in, I just started my practice, and there was a builder, and he came in, his very last slot of the week, 5 o'clock on a Friday, came in regularly then, and I just could not get this guy better. But the thing was, he just kept coming back. It was like, please don't come back, don't come back, stop torturing me. You know, I felt I was doing nothing for this person, absolutely nothing, yet he kept coming back. And so there's many aspects to these patients when we can't get them better. And there's many aspects that are technical, and I'll go into those in other videos, of areas that we need to look at, looking at cause, all sorts of things that we can look at technically. But the one most important factor that underpins everything in terms of patients that aren't getting better is the emotional impact it has on us and how we deal with that emotional side of things. Now, what happens generally is that when you have a patient that doesn't get better, it's going to challenge you, and it's going to challenge you emotionally and bring up a little bit of fear, perhaps a lot of fear, and what that tends to do then is it tends to clamp us a little bit. We tend to tighten a little bit inside, and we tend to lose our connection. We lose our connection with the patient, and we lose our connection with our skill, with our ability to, whether it's putting our hands on our palpation or whether it's our voice and asking the right question. Because what happens generally is when we get confronted with that, it can become a little bit of a tennis game, whereas you'll say, oh, well, you know, how are you? And you say, oh, I'm not doing very well. And so, okay, so we'll bat the ball back over towards them. What about straight after treatment? Because you remember that they were quite good when you left them, when they left clinic. And they're like, oh no, that only lasted for like an hour, and then it came straight back like it was before. You know, bang, the ball comes back over the net at you, and you're like, okay, where do I go with that? Do you say, oh, I'm sorry? Or do you like say, you get defensive and say, oh, well, you know, definitely when you left it, you know, it was looking quite good. You remember we did that, it was improvement. So was there anything that you did in that hour? You know, so what you're doing, you're batting the ball back across to them, and then they feel like they're being attacked, and they're like, no, I didn't do anything different. And it back and forth, back and forth. We're losing that connection verbally with them. And the same thing happens maybe on a hands-on, and maybe not as overt as that, but you're putting your hands on, and they're like, ow, that's sore. And, you know, that connection is lost. And so it's the emotional side of it that is the most important aspect to get right first off. And then we can start delving into different areas in terms of technique or in things that you do in terms of history taking, examination, that allows you to dig deeper. And so with these patients that aren't getting better, you're then able to deploy those skills and get a better level of information coming in, a better level of contact, a better level of communication, so then you can move on and help these patients. And so what I'm going to do in this video is just explore that emotional side a little bit more. Because what can happen, especially if you're a young practitioner, it can throw you into a little bit of a tailspin in terms of the way I just described, but it can also be a lot more subtle. And this conversation is coming up because I had a discussion with one of my associates last week, because she was asking me about a patient that she'd seen 6 or 7 times. And this is a patient that I'd seen previously and has been seen with other practitioners in the clinic, and is a particularly difficult patient to fix, shall we say, to use that word. And this practitioner was saying to me that she really felt she wasn't helping this patient at all. And what was happening is that she'd get an improvement in the treatment, and the patient would say, oh yeah, that feels a lot better. But when she'd see her the following week, the patient would say, you'd ask her, how did it go? And the patient would say, oh, well, you know, it was a few hours of relief, but then it came back again. And so this young practitioner is thinking, well, you know, a very moral practitioner, a very good practitioner, a very good person is thinking, well, I'm just not doing any good here. You know, a few hours of relief for the money you're paying for treatment. You know, really, I should be getting rid of this patient. And so that's what she would ask me about. Because when she talked to the patient, she was saying, well, you know, perhaps we should push it out a little bit longer, or perhaps you should go and try this or try that, you know, as in, you know, giving that patient that graceful exit. That patient wasn't taking it. That patient would say, no, I want to come back next week. And so the practitioner was like, well, hang on, I got this patient that's telling me they're not getting better, and yet when I say to them, perhaps we should push out treatment or go somewhere else, she's like, no, they're really insistent on coming in and seeing me. And so this is inconsistent. You know, the behavior is inconsistent. I'm not getting better, and yet my actions are saying I am getting a lot of value from this treatment because I want to keep coming back week after week after week. And it reminded me, to come back to the start of this video, it reminded me of that practitioner I saw when I first graduated, that builder that kept coming back in time after time. And it was like, stop torturing me. But what that was my own mental, where I was emotionally, where I was in terms of that fragility of my ego, in that a patient isn't getting better, that means I'm no good. And so if we switch this to a little bit of an analogy, we could say that, you know, what's happening sometimes with patients is that it's like they're in the water and they're in the sea and they're drowning a little bit and they're struggling and they're, you know, kind of sinking under with the pain and the difficulties and the lack of function they're getting in their life. And as a practitioner, we swim out to them and we kind of yank them out of the water and we swim back to the rescue boat and we dump them in the boat. Excellent, we've saved them, you know, our ego feels good, we're getting something out of this. So it's not just that ego in terms of, you know, I'm awesome, but it's also that kind of wider ego of feeling, okay, I'm doing something worthwhile in the world. This is what I was born to do, to help with health, to help people. And that actually is great, it's awesome. Now what happens is sometimes when we swim out to the patient and we pull them up, you know, they keep dropping back down again and we can't get them out. That's the patient, you know, in the treatment that you can't get better, and that's, you know, pretty confronting. And that might be that we're just not able to, if you like, save that patient. We're not the right person to, you know, be doing the life saving for this patient. But sometimes what happens is, you know, you get that person, you pull them into the boat, and then they kind of straight back in again. It's like, well, what's going on there? You know, and then it's starting to sink. We're pulling them out, back in again, pulling them out, back in again. And that's the patient that gets better for a couple of hours, but then goes back again. Now, digging into that, it's really important for us to do is to try to separate out what is going on for ourselves and what is going on for the patient. Because there might be completely valid reasons for that patient getting worse again, which is nothing to do with our treatment. It might be, for example, they're going up and then picking up their child, or they're going straight back into work and laying 1,000 bricks. You had patients like that. You know, my back's the same as it was last week. And when you ask the question, well, what did you do after treatment? I went back into work and they're a bricklayer and they're laying, you know, 1,000 bricks that day. So, well, okay. Then the conversation is about, you know, you're going to have to change the way that you do things if you want to be out of pain. You can't tell them to stop working because that's not your right to do that. They might be, you know, need to feed their family or whatever, but you need to explain to them the consequences of what's going on. Now, if you're able to step back from the confrontation of the patient's not getting better and what's that doing for you emotionally and triggering your stuff, then what happens is you're able to have that clarity and you're able to speak from that place of clarity. And that's key, because telling the bricklayer, hey, if you continue to do that, you know, you're going to continue to be in pain. If you're doing that from a sense of defensiveness, backing the ball back over to them, well, you know, you are doing this, you know, you're kind of, you know, pushing that at them as their problem. That's coming from a place of you defending yourself. Now, the person hears that energy behind the words. Now, if you use exactly the same words, but you're in a place of clarity, quite happy with the fact that you are doing the best you can for that patient, you checked in with that, and that if that patient decides not to come back, that's fine. But if they do decide to come back, that's also fine. You're just simply doing the best for your patient, and then that's it. You're putting the load down. The rest is up to the patient. If you do that from that sense of clarity, then the person hears the same words, but they come over differently. And you often will get a change with that patient, and the patient is able then, or often you work with that patient, and you're able to find a way that you're able to adapt what they're doing. You know, for example, to give you something different, often what you'll find is patients, you know, they're on their feet all day. They're in retail. I remember one that was working at the airport, and they're on their feet all day and their back starts to play up. And so they're not able to stop doing that. They have to be on their feet all day. However, if you give them little things like changing their shoes. So what happens if you change the shoes, you know, every hour, then what happens then is it changes the dynamic through their whole posture. So that's a physical thing that you can give them that also emotionally is supporting them, and they feel that they continue to do what they can do, the work, whilst coping with the load that's on them. So there's different things that we can do tactically, but if it's coming from that place of clarity, then it's just so different for the patient as how it's received. And so it's that emotional aspect that's really important. Now, what happens if we aren't able to be clear, and that was happened for this practitioner I was talking to you about, my associate, and also when, you know, that example I gave you with the builder when I first started, and many other examples I could give you, if we're not clear, then what happens is our stuff gets involved with their stuff. And we think, oh, well, we're not giving value. You know, the person, I haven't fixed them in 3 treatments, I haven't fixed them in 6 treatments, or they're just complaining all the time, over and over and over again. Well, of course, what's happening is there with some of those patients, the emotional load that that patient has is so great that they aren't able to move through this state of pain that they're in. So yes, there's structural aspects to it, but there's also deeper emotional aspects. And in those cases, what's happening is all we're doing is keeping that patient afloat. And to use that analogy I used before, is what you're doing. You swim over to them, you've got them, you bring them out of the water so they can breathe, but that, if you let go, they're going down into the depths. They're not coming back up again. And so the patient realizes that, and that's why the patient clings to you, a little bit like that life-saving, or sometimes they not just clings to you, but actually fights you. You see someone trying to save someone that's in the surf, and that person is so in so much panic and so much fear that they're fighting off, they're trying to kick off the person that saves them. Sometimes you might have experienced that with patients as well. So what happens there is we are keeping them afloat. And it's really important to know that if you let go, they're going to sink. So sometimes those patients feel very heavy because they are a burden. And so that's why it's important that you put your patient load down, and then when you leave the room from a patient, they're gone. They're gone from your mind. Yes, you might come back and do the notes. Yes, you might think of them when a video like this might make you think of a patient, but there's a specific space you're opening up to think about that patient and hold the space for them. Other than that, you do not want to be holding the load for these patients because these patients are heavy. But having said that, there's a lot of these patients out there, and that is part of our job as practitioners to support those patients. And if you start to get clear about understanding what's going on for the patient and what's their load and your load, and then what your interaction is between you and what you're going to do in terms of helping them support that load as they move through, then what does it just clears you a lot more. It just clears you. You get to do better work, but you also don't get to carry so much of that burden. And then you understand what's going on. Now what may happen is you may say, well, I don't want to treat these type of patients. And that's a conscious decision, and that's absolutely fine whatsoever. Doesn't matter at all. You get to choose the patients that you want to treat, the type of patients you treat. But the key message I'm putting across here is don't drop patients because you think you're not good enough and you're not doing a good enough job, because often that's not the case. Those patients, you are keeping them afloat and you are doing an awesome job, and without you they are going to sink. But they don't provide the same ego kind of reward that the patient that comes in with the bad back and they can't walk, and then you fix them and they walk out and they sing your praises. Yeah, so it's a different type of thing, but it's just as important in terms of the load we do, just as important in terms of the work we do. So I'm hoping that's of great use to you. I will delve more into patients that are hard to fix, but more into the technical sides of it, which will build on what we're doing here. So not only do you have this emotional clarity, but then that emotional clarity gives you the ability to put the right tool in place. So, okay, I'm clear about what's going on. This tool here, history, I need to dig into history a bit more. No, that tool, I need to dig into examination. I haven't been able to do the examination well enough because the patient is in pain, and every time to the examination they're complaining, and that complaining feeds into my kind of sympathy for them, my empathy for them, not wanting to hurt them. So again, how this kind of shuttles back and forth. Or, no, we're picking up a technical skill. They've got a headache and that headache's not getting better. They've got a neck pain and that neck pain's not getting better. Have I looked at the diaphragm? Have I looked at the sacrum? Have I looked at the 3 tents that we call, or the 3 diaphragms? The pelvic floor, the diaphragm, the tentorium. All of these different technical things that we can dig into, but they're not going to be of much use to you unless you're able to get that clarity. So I advise you moving forward, really start to think about those patients that you aren't getting better, and do that little review. Okay, what's me, what's them, what's getting mixed up, and how can I let that go to get that clarity, be in my midline, be really connected to myself, so I get the connection to the patient, so that I can do the best job for that person, the best ability to get them better, but not overstep the mark and get drained emotionally, or withdraw because it's challenging me emotionally, and then leave that patient to drop away into the depths and to drown. If you'd like more content that's going to help you in clinic, including treating adults and including treating babies, just check out these playlists here, or just click on the subscribe button. That will tell me that what I'm doing is really appreciated by you guys, so I really would love that. But also, of course, it will mean that you keep getting updated with all of the new videos that I will upload to this channel.